Trying to assess the severity of heart failure, there are some two main criteria or two main classifications, sorry, of the severity of heart failure. So now, in trying to access the severity of the disease condition, you are just trying to access okay, like how far has the disease condition actually caused damage in the body, all right? So we're looking at this, and there are two classification or categories. We have the NYHA, that's the New York Heart Association. Then we have the American College of Cardiology. These are the two standard um, categories or classifications of heart failure. So heart failure severity or staging is crucial, okay, and it will help you determine which type of treatment, okay, you should offer for this type of heart failure problem, and also it will help you determine the prognosis of the disease condition, like what is the likelihood of the patient recovering from the disease condition, right? So the most common classification systems include, we have the New York Heart Association functional classification. So you have it here. It's the same thing as this. Okay. So I feel like let's just read what is a note. Stage 1 means there are no symptoms or there's limitation in ordinary physical activity, right? Stage 2 means there's mild symptoms with slight limitation in physical activity, okay? Stage 3 means there's marked limitation in physical activity due to symptoms of heart failure. Stage 4 means there's severe symptoms at rest, even when the person is resting, or even the person just try to do one small exertion walk like this, okay? The symptoms will shoot out, okay? Then I'm talking about this next classification or category, which is by the American College of Cardiology or American Heart Association. We have the stage A. This one is what? Okay, see here. Talk about the NYHA, all right? Then we're talking about the what? American College of Cardiology and American Heart Association now, right? Stage A means at the person is just at the risk of heart failure, right? So the risk factors for heart failure are present, all right? But you can't really say there's heart failure, all right? Then stage B means asymptomatic heart failure. That means there's some structural changes, but there are no obvious symptoms that there's a heart failure. Stage C means there's symptomatic heart failure. That means there are some structural changes and obvious symptoms that there's a heart failure. Stage D means advanced heart failure. That means there's a severe what? There's severe symptoms and there's refractory to treatment. Okay, treat and it comes back, treat and it comes back, and all that. All right. Then the American Heart Association heart failure stage is just like the same thing with the American College of Cardiology. Stage A, there's high risk, no structural disease. Stage B, there's structural disease, no symptoms. Stage C, there's structural disease and symptoms. Stage D, there's what? Refractory symptoms, and there's advanced disease. So one thing is, this classification system to basically help you to know what type of heart failure you are dealing with, and it will help you to what? Decide the appropriate what medications that you use for different types of what heart failure. All right, so that's it. See you guys.